All right, I think we're pretty close to 6 o'clock here. We're going to wait just maybe another minute or two to see how many others are going to join us. But the topic tonight is the Silhouette Instalift, and I have with me Annie Darling, who had the procedure 3 months ago. We thought it would be helpful if you could see someone who's had it and then also have an opportunity to ask her questions directly about her experience, both during the procedure and post-operatively. So we will get going here in just a minute. My new high-tech Apple Watch. My family wants to know what's for dinner tonight.
Nothing. Ask your dad.
Ask your dad.
Ask your dad. Ask your dad.
Okay. I think we'll probably get started. And these webinars are recorded, so if you find something interesting and want to share it with somebody, you'll be able to find them on our website. They're edited, so you just get the pertinent information and not the whole hour. But our topic tonight is the Silhouette Instalift, and this is a technology that we're super excited about here in the practice. And again, this is Annie Darling. She's a patient who had the procedure October 4th, so just over 3 months ago. And we have her here so that you can A, see what she looks like, and then B, also feel free to ask her questions. So I'm just going to go through some of the clinical information first and explain what it is and how it works. And then from there, we'll actually show some videotape of Annie's procedure so you can really get a good idea of what it might look like for you having the procedure. So let's get started. Silhouette Instalift has actually been around for quite a while in other countries and is FDA approved for being a minimally invasive device to lift the mid-face. And what we're really talking about is kind of the cheek area and then the jowling area. It's a procedure that's done in the office under local anesthetic. You'll walk in and walk out on the same day. You don't need a driver. Minimally invasive, meaning there aren't any incisions. There are simply a few areas of your face that are numbed with the local anesthetic, and then a needle is used to pass the threads and cones. Some people may remember the whole concept of a thread lift that was around about a decade ago. This is a completely different technology. Some of the basic principles are similar, but the technology is very different, a much safer procedure. The sutures that we're placing are placed to reposition subdermal tissue, and I'll show you on my face. We're specifically talking about mid-cheek and jowl area down here. So the goal is to use the sutures to suspend those areas. The sutures and the cones that are part of the suture are made of a polylactic acid, and some people on the webinar may have heard of an injectable called Sculptra, which was widely used for facial atrophy and still is a very good go-to for facial atrophy. And this is a protein that stimulates your body to generate collagen. So in addition to placing the sutures to provide the lift, the material that they're made of is absorbable and stimulates collagen growth. So you get some added volume because of the suture material themselves. We also know that when we use the sutures, it helps with the overlying skin. I'm just moving this around to see if I can get you to see us on the slides at the same time. So the goal is to stimulate as much collagen maturation as possible, in addition to repositioning your mid-face, and that's what helps with the overall good result in the end. I'm just going to get us out of here for a minute so we can see the slides better. So we have a lot of great technologies for revolumizing the face using fillers like Juvederm or Voluma, Radius. There's many different materials out there for volumizing the face. We have really great technologies for resurfacing the skin, Infinity microneedling. We have the Cutera, which can help with pigmentation, fine lines, and wrinkles. And we have Botox for relaxing muscles, which helps with the wrinkles, especially around the eyes and forehead. But we haven't had anything non-invasive for resuspending. So when we talked about resuspending, it was pretty much going straight to a facelift. So this technology really meets this unmet need that we've had as far as facial rejuvenation to address kind of all of the levels of the face. And the goal is to restore volume, reshape that face, and also improve the overlying skin. So this is really an exciting part to kind of complete the process of what we can do in the office under local. This is what the technology looks like. It's a suture that has cones on both ends. They're bidirectional, meaning that each end of the suture the cones are facing opposite directions. They come in 4, 6, or 8 cones, and most of the facial procedures we're using the 4-coned sutures. They're completely resorbable, so there's nothing permanent in the skin or subcutaneous tissue after the procedure. They resorb slowly over time, again, stimulating collagen growth and improving the skin quality overlying the sutures with that stimulation. The FDA-approved indication is for mid-face suspension, and the goal is really to fix the subdermis of the cheek and to a higher, more aesthetic position. The whole procedure takes less than 45 minutes. It's under local. You don't need a driver. You don't need any pain medication. It's very well tolerated. This is just an up close of what the suture material looks like. You can see that it's clear in nature. This makes it look like the diameter is quite large, but it's really as small as the diameter of a needle. So who does this work for? It's not for everyone. Almost everything that we do in plastic surgery, there's specific indications. It's good for somebody who has good skin quality. The skin can't be too thin and it can't be too thick. If someone has a very heavy face, the small sutures aren't going to be enough to provide suspension. And when I'm examining a patient, I need to make sure that when I do touch their face that I can easily mobilize and suspend the area that we're looking at. And again, we're looking to treat this area here and this area here. This is focally what these sutures are designed to do. And these are all examples of patients who would be good for having this procedure. So they have, an amount of sagginess in this kind of mid-face area that we can see. You can see that the skin is thick enough to accommodate the sutures. And these are the lines, again, that we want to be able to treat in these patients. When does it not work? It doesn't work very well if someone has a lot of heaviness or a lot of excessive wrinkles in the skin. It doesn't have the power to move this amount of skin and volume. If someone has a heavier face or heavier jowl, it's just not going to be enough. And on a patient like this, we would recommend going straight to facelift. This patient over here is just an example of someone who's too thin. The suture material, although it's small, it needs enough of subcutaneous tissue in order to get absorbed and not be visible to the outside world. And if someone's really thin, there's just not enough space in that subcutaneous tissue to hide the sutures. So these are the areas that we're focused on, elevating the mid-face and jowl. The white dots that you see here are the points of entry for the suture. So part of the procedure is numbing up just these areas. So this is the number of needle sticks that would be required for 3 suture placements. In some cases, we need to place 5 sutures, so 3 in the mid-face and 2 down on the jowls, just depending upon how much needs to be lifted. So local anesthetic to these spots, and then the entry point feeds the cones up to the exit point. And in point of fact, the exit points are really up here and kind of down here, a little lower than what this schematic depicts. And the needles are passed underneath the skin to exit there. And the cones that you see here is what's ending up in the subcutaneous tissue at both ends of the suture. So the high end is where the cones would be, and then the low end is where the cones would be. And the intervening segment between the cones is just a thread, just like this. Patients have minimal acute inflammation from the procedure. What we see at the time of the procedure is just a little bit of swelling at the site of the local anesthetic. There's minimal bruising. We provide you with the list of medications to avoid for injectables, and it's the same list that we would use when using the Instalift. Because there is the needle introduced to the skin, there is a possibility of some bruising, but it's usually minimal and mostly just at the site of entry. We haven't seen anybody have an allergic reaction to this material yet. Potential side effects would be a nerve injury, asymmetry, and banding from the site of the sutures. And again, we haven't seen these things yet. The sutures are placed much more superficial than any of the important nerves, but there could be some numbness in the focal area, and most likely that would be transient and resolved over the next couple of weeks. So this is a patient who had the treatment. This is a 1-month result, and you can see the improvement in the line of her nasolabial fold here. And at 1 month, there's no residual evidence that anything was done here. Another patient, a month later, and again, improvement in the nasolabial fold. This is just a third patient who had treatment of a similar area. This shows immediately what she looked like after. There was placement of 3 sutures, 2 at the midface and 1 along the jawline. You can see that there's some redness. The light area that you see is the effect of the epinephrine and the local anesthetic, so there can be some swelling and some epi effect around the needle sites, but nothing terribly dramatic. And then this is what she looks like 2 weeks later. So at 2 weeks, there's no residual evidence that anything was done. And a few months out, you can see the effacement of these folds. So not only has it lifted the face, which is evidenced by the softening of these folds, but you can see some improved quality in the skin, tone, and texture, which I think is more obvious when you compare it to this photograph. So some improvement of the lines, but also some volumization, above these areas where those sutures were placed. So it's kind of a trifecta. You get the lifting, you get the volumization, and you get the skin improvements with these suture materials. Another patient, pre-treatment, and then at 14 days. This is her at 14 days, and then the pre and the post on the same picture, and you can see the improvement. And this is a good slide for me to point out that it's not a facelift. We haven't gotten rid of everything here. It's not a neck lift. We haven't improved every single fold and wrinkle. But you can see a pretty dramatic improvement in her midface and her jowls. So although it's a terrific procedure for what it does, it only does this one thing, and it's not really a replacement for a facelift. If anyone has any questions at this point, we can certainly take those. And then I was going to pull up the video of the actual procedure. One that we'll start with is just what it looks like when we mark a patient. This is Annie, the patient that we'll show you pictures of her in just a second, real time. But you can see part of it is just me seeing, how much do I need to lift? Is it mobile? Can I get it where I want to go? What's the area that we're focusing on? And on her, we're really focusing on the midface and the jowl. And the first step is just marking out what we want to address. After we mark out kind of where we want to go, the next step is actually measuring the length of the sutures. So we know the length of the suture, and we know the vector that we want to pull. And it's actually just finding the measurement between the entry and the exit point. That's a nice shot of the back of my head. The entry and the exit points. And that's so that we can have precise placement of the vectors for pulling in the direction that we want to pull. And this is variable from person to person. The vectors can range kind of from superior to inferior, and then sometimes the pull is more lateral. You can see how excited Annie is to have this procedure. So that's kind of the key, is kind of marking and making sure that we know what we're going to address. After we've decided how many sutures we're going to use, and that's another point, that not everybody needs 5 or 6 sutures. Some people may just need 2 sutures if they just want to focus on the jowling or just focus on the midface. So it's not that there's one standard way to do this for every patient. It really depends upon a specific. Yeah. So Annie just had 2 sutures, just in the midface area, and that was enough to get her where we needed to go. So you can see right now, this ruler helps me know exactly where the cones are. It's a measurement of the cone entry and exit points. So I know that this is my segment where there's no cones, and then that there's going to be 4 cones here and 4 cones up here. So that's what we're marking to make sure that we have proper placement on the vectors that we want to work on specifically for her anatomy. And part of this is patient input, patient goals. I think people know what they're looking for, whether they're just concerned about jowls or they're just concerned about the nasolabial folds. And that's how we tailor how many sutures and the exact placement of the suture. So that's the first part of the procedure. After we've marked those sites, we use a local anesthetic. This is the site where the needles are going to go in, And this is the site where the inferior exit is going to be, and that's the site where the superior exit is going to be. And you can see she's relatively comfortable. It's a small needle, and it provides the local anesthetic. We only have to localize the sites of entry and exit because the placement of the needle in the subcutaneous tissue is in a plane that's not painful for patients. It seems surprising that you can stick a needle under the skin and it doesn't hurt, but it actually doesn't hurt. It's through the skin, where's the painful part. So that's why the local anesthetic is only at the entry points and the exit points. And obviously the more sutures we use, the more local anesthetic that needs to be used. And this is really the worst part of the whole procedure. I'm asking Annie now. Nobody likes getting a needle. So I'd say this is the worst part. It's relatively quick. It's a small needle, and that's the localizing portion of the procedure. So now we have all sites local, and we know that this is our entry. We use a needle to create the pathway for the passing of the suture. So this above one, we already had this needle in there. We created that pathway, and now I'm passing the suture from the entry site to the end of the nasolabial fold here, which is the area that we want to lift. And you can see that she doesn't look like she's in. You can see that she had some discomfort when I was putting the local in, but now she looks pretty comfortable. And I'm just making sure that the needle's in the right plane and that I'm getting where I want to go. And I can see where my exit point is. And that's just an instrument to help me pull the needle through. So you don't see any of the thread here. Right there, you can see that I'm pulling the cones through. So there's 4 cones that I need to get through down there. And they kind of, click a little bit through the skin. You can kind of feel them go as they go through. And then through the same entry point, I'm introducing the superior portion of the suture. You can see how small and thin that suture is. It's barely visible on this film. And then we pass that through that same entry site and then superiorly in the vector that we want to pull that nasolabial fold. And you can, again, see that she looks perfectly comfortable. It's easy to pass the needle in the proper plane. And then this is the exit point, where we want it to come out. And again, this has all been measured. We know the exact length of the suture and where we want the cones to sit to properly address the area of concern. So similar to that, you can see as I'm pulling the suture how it's pulling this fold up just with a little pull there. So you can see it's already grasped that tissue there. So same thing's going to happen at all 4 sites. An entry and an exit along the vector is where the suture's passed. And you would say this part, this was relatively painless for you?
Yeah, it looks a lot worse than it was.
Yeah. It looks like a big needle, and it looks like it'd be uncomfortable, but in actuality, it's really, again, just the local, that's the uncomfortable portion of the procedure. And let's see. And then after we get the needles in place, the last phase is making sure that they're captured. So what I'm doing here is making sure that the soft tissue where I want to lift is attached to those cones. And the first portion is to make sure that it's attached inferiorly, and that's with a little bit of pressure on those areas. And you can almost feel the pressure kind of clicking those cones into place. So first that's done inferiorly, and then in a second you'll see that when I pull the suture from up here, you can see the lift of the mid-face. And again, it's pressure on the face, but not particularly painful to have this portion of the procedure done. And then you can see when I pull that suture how it's lifting that whole area, just one little tiny thread. So you can imagine when you need pull from multiple sutures, the broad effect you can have in lifting that area. You can see what effect just 2 sutures had on her mid-face area. So the goal is to pull them and then seat the cones on the superior aspect of the vector. And near the end of the procedure, we're just cleaning off the skin, and the sutures are trimmed both inferiorly and superiorly. She has that same epinephrine effect, a little bit of swelling at the sites. If there wasn't a purple magic marker, it wouldn't really be terribly obvious that she'd had something done. Minimal swelling, minimal bruising, and she can go about her day after this. One of the commitments after this procedure is to try not to. I'm trying to see if I can share our screen here. But fundamentally, this procedure, the whole goal is to have a non-invasive way of lifting the mid-face and jowls in the office under local with minimal downtime. So the question that I see here is, were those needles going through the cheeks or strings? So the needle is actually connected to this string. So this is the string, the middle portion of the string, and this is what it looks like on the high end and on the low end with these cones. But there is a needle attached on this end of it, and that's what allows me to enter it into the subcutaneous tissue. So there is a needle that's used to thread this into that plane. But the string is what's left behind, is this portion, and the needles and the string that comes out of the skin is cut up at the level of the skin. So there's nothing hard that's left in there at the completion of the procedure. The needle is simply the mechanism to pass the string through the proper plane. And I think on our videos, I can find one that has the needle so I can show you better. So this is a needle. This right here is the needle portion, and this is the string, and then you can see the cones up here. So the needle's entered to the skin. It's attached to the string and passed in the subcutaneous tissue. The needle is what allows us to aim it in the proper vector. And you can see when I pull it out on this end, it's just the string that's left underneath the skin. And again, the needle, when it's in the subcutaneous plane, is not a painful thing. That's why the local is in the areas of the entry and the exit. But you can see it's not causing her any discomfort to get that needle past her. So there's the needle, and then there's now just the string. So all that's left behind is that string. And here I'm pulling the cones into the subcutaneous plane. And then you can see these cones, almost see these cones that are going to go superiorly. So again, I'm using the needle to thread that string in the subcutaneous plane. Any other questions about the procedure specifically for me, either how it's done technically or questions for Annie? Again, this is a picture of the strings going in. And you can see on the other side, the strings are there, but we've cut off the needles. And the reason the strings are there is we first place them, and then we want to see what pull we get on both sides so that we can make both sides symmetric and even. And that's how that works. We're trying to make it so that you can see us. Huh, okay.
Should we go to another question?
Yeah, let's see if there's any more questions. Let's see what else there is for questions. You can expand that. So are the strings and cones permanent under the skin? No. So the strings are, they're not permanent. It's made out of a material that stimulates collagen growth, and your body absorbs those strings. So at about 8 to 12 weeks, the strings are gone. The purpose of the strings, the cones, are to suspend this tissue, and then that material is meant to generate collagen. So in addition to suspending the soft tissues, it also creates volume in the long run. So they're completely absorbable. If you went back 3 months later, you're not going to find any residual strings. You would just see the collagen generated by the placement of those strings. So they're not permanent. They are designed to stimulate tissue growth and hold those tissues in place. So there's nothing that stays around in the long run. So far, there haven't been any reported allergies or inflammatory responses. What can happen is sometimes, depending upon the length of the string in the face, sometimes there's some cones that can come out at the top end, especially. And Annie actually has one of these, so that can happen. You can feel the top edge of the cone, and we just trim the suture once everything's healed and settled in place. So there's no, nothing happens with that suture material there. But before we started this webinar, Annie was telling us that she really didn't notice, too much discomfort. And right around 2 weeks, that she did laugh pretty hard. And so it's one of the instructions, probably the hardest part is, for the procedure, you're not supposed to laugh. You're not supposed to eat like a big cheeseburger. You're supposed to really have facial animation rest, which is pretty difficult, to kind of control your life in that way. But the goal is we don't want to have any major motion in this area while it's healing and healing. At 2 weeks, you're safe to do whatever you want to do. But for the first 2 weeks, it's important to, chew in small bites. Try not to belly laugh with a big wide open mouth. Try to sleep on your back, positioning your head in an elevated position so that you're not going to roll over on your face and move those cones around. So it does have to settle in and seal and heal and get that inflammatory response to make that, that suture material last and also to keep the result in a long-lasting fashion.
So when I did laugh, I just felt a prick in my skin.
Yeah.
I was like, oh, okay.
A reminder.
Stop, laugh.
Yep. Yeah.
So, and that was the healing effect I had.
Right.
Sleeping on my back was hard with pillows.
Yeah.
But,
yeah, and did you feel limited in any way, that even the day of your procedure?
No, I didn't. Yeah. I didn't. It was pretty smooth and pretty clean, and you can see the result. Hopefully people can see me now too. You can see the result. I don't know, can I point this out here? Especially down in this area, you can really see where it's really helped, and up in this area. So it's been 3 months for me, so there's still a couple of months where that collagen will build, and but I can see great results already.
Yeah. And that's kind of the interesting part about a lot of the non-invasive technology now is we're avoiding, large incisions and larger recovery times, but there's also some time involved in getting to your final result. We probably will do a webinar soon on the Thermi. It's the tightening procedure for the lower face and neck. And similarly, because we're waiting for collagen regeneration, that final results really are close to 6 months because of that volumization. The inflammatory response and the healing in response to the sutures take that long. So it's you see the lift right away, which is rewarding, and then it's kind of the gift that keeps on giving. It just gets better and better and better as that inflammatory reaction helps generate collagen and volume. A lot of what facial aging, why we start to look age isn't just the quality of the skin, but it's loss of facial volume. So an important part of that procedure isn't just repositioning, but also volumizing.
I was just going to answer Megan's question, and about resuming work and life schedule. I didn't skip a beat. I did exactly what I walked out and just had a normal day, just like I always have. And that redness that you see and the suture holes or whatever that you see went away probably the next day or day after. They were not apparent within a couple of days. Yeah. So I did not have any problem with that. Yeah. Went right back to doing my normal schedule. Yeah. Pretty much when I left.
As far as how long it lasts, it should last a couple of years. You could see from Annie, we did 2 sutures. She could decide a year from now, I would like a little more correction, and we could put in another suture or 2. Some people elect to have, 3 to 6 sutures, and then the chance that they're going to need something in the next year or 2 is pretty small. So it's really a matter of how far you want to go, but it is permanent in that, the effect of volumization and the lift is going to stay with you. The fundamental problem with everything is that we all continue to age. So tomorrow we're going to be older than we are today, and we have less potential to generate collagen. So yes, is there maintenance? There is maintenance. And it just depends upon what degree of improvement you're hoping to stick with. But you shouldn't need anything to get you to where you are today for a good 2 or 3 years. This can also be done in conjunction with other things. So someone could come in and have a laser treatment for pigmentation or vascularity and have the silhouette Instalift and also have volumization at the same setting. So we can add Juvederm if someone needs volumization around their mouth, or the oral commissures. Voluma is a quick way to add cheek volume to this procedure. So it doesn't have to be done in isolation. Again, it depends what the final desired goal is. That's the beauty of it. You can kind of do as much or as little as you want to do. But as far as lasting, you should see a result that you're happy with for a couple of years.
And I think for me, the most important thing for me in having something like this done is I just feel better. I feel like I look better when I look in the mirror. I just feel better about myself, and it really is uplifting.
Yeah.
To have this kind of thing done. It just feels good.
Yeah. We had a patient who came in yesterday, and she was telling us that everyone has been asking her if she has a new haircut. Like, they would tell her, I love your new haircut. Did you get your teeth whitened? Did you lose weight? And not be able to actually pinpoint what was done, but that she obviously is feeling a lot better. People are noticing that she's looking better and feeling better without being able to pinpoint the exact procedure that she's had. So I think that's the key. Someone wants to know how old you are. Do you want to share how old you are?
I'll be 58 next month.
58. Yeah. That's a good question. We were joking that, like, ahead of time, is there anything she didn't want to answer? And she's like, what, are they going to ask me how much I weigh? So, yeah, I feel like this is a durable technology. And the other thing that's nice is this polylactic acid has been around for a really long time. Sculptor's been injected for years and years and years. It's a material that's been in suture material also for years. So the track record and safety is, it's high. It's been around. It's not experimental. Yes, we haven't used it in this particular fashion, but it's, tried and true as a safe mechanism for collagen generation. And that's been going on for many years. So I think that, the safety of things is obviously very important. We want you to get the result that you want, but also be as safe as we can possibly be.
And it's a pretty simple procedure for the effect, I think. Mm-hmm. I think the effect was really great for the, 45 minutes or whatever the length of the procedure, and the pretty much no pain aspect of the procedure. So
yeah, I think so, right. to limit downtime and that amount of time that you don't want to be seen by the public. I mean, it's just it's pretty quick. And again, the chance of bruising, some people bruise more than others, but in general, because the sites are so small, it's relatively minimal. Is the procedure cost effective? I think it is. I think, depending upon how much time you have for recovery. A facelift, to achieve the same effect with the facelift, you'd have an incision that starts at your hairline here and runs along your ear. And the dissection that's done underneath the skin is all, through this area. So, from a bruising and swelling standpoint, from even a risk standpoint, the risk of having a nerve injury or having something happen with these sutures is much less than a facelift. The risk profile for a facelift, you could have bleeding, you could have a nerve injury. Do those things usually happen? No, they don't, but the risk profile is certainly higher. And then I think the effect that you get can be, a great kind of segue. This is something, is she going to want a facelift when she's 70-something? Maybe she might. But this is enough for her to feel a lot more confident, and it only took 45 minutes in the office under local. So as far as cost effective, I would say yes, because she's not lost any work. There was never any downtime. You didn't need any recovery. She didn't have to back away from her life to recover from this. So that's another portion of kind of having surgery. Other treatments. Have you had any other treatments before or since?
Yeah. And I can't remember how, I've had Juvederm and...
You've had Voluma.
Yeah. And in comparison to those two, I feel like this is, with the Juvederm and Voluma, I saw results up here, but this really brought up my lower face, which was, to me, made a huge difference in where I was getting the lift. So the lift was more in here and taking care of some of this area down here than to sort of just add volume up here. Yeah. It really brought this area up. So to me, that was the difference between doing something like a Voluma or whatever, which I did in the past and I enjoyed, but this kind of brought the lower section.
Yeah. Yeah, I think it's a great question of what are the other treatments. I mean, I think anybody who's looking at this type of procedure, the thing that we always start with is what are you using for skincare? Are you using adequate sunscreen every day? Are you taking care of the surface? Taking care of the skin is a really important part of this whole kind of maintenance plan for rejuvenation. If your skin's not in good shape, it doesn't matter how far we pull things or how much volume we add. The overall effect is less than if your skin is well taken care of. So unfortunately, there's not one thing that we could do that addresses everything. We use lasers and peels and topicals for the skin. Volumization is either off-the-shelf fillers, like Annie just mentioned, Voluma or Juvederm for small volumes. For larger volumes, we recommend fat grafting because the cost of fillers can get very high if you need a lot of volume. So we can actually use your own fat to add that volume. And then,
could you do that fat grafting in addition at the same time as this? Or?
You can. You would do the fat grafting or the volumization with the filler like Voluma first, and then do the suture lift. So it's addressing, all layers, addressing the surface, addressing the subcutaneous, addressing the volume. So it's a multi-pronged approach for rejuvenation, and they kind of all go hand in hand. And I look at all of these things are just maintenance, just like most of us go to the dentist every 6 months. You get a teeth cleaning, and the goal is to keep everything maintained and in good shape so that you don't need anything, super major to keep things healthy. So I think a little bit of maintenance goes a long way for keeping people looking youthful and healthy. But it kind of all goes together.
And I think you can see, I can tell looking at the video myself, that it's not a huge change really in terms of what, how much my skin is lifted, but it's made a huge change in myself. Like I can see, like from the procedure standpoint, it's not a huge procedure, but I feel like it did a lot for me in terms of just changing the shape of my face back into a more youthful look. So I think it's, for me, that the procedure was well worth it in terms of time and cost.
Yeah. Any other questions about how it works or anything about the materials or the post-treatment? Like I mentioned, post-treatment, the important part is really as much facial rest as you can stand it. We want those cones to stay where they're placed and have time to settle in, which takes about 2 weeks. So it is sleeping on your back with your head elevated for 2 weeks. Cutting your food into smaller pieces, trying not to, give your best smile. It's a funny thing to have a procedure and ask you not to animate afterwards, but that's the goal is to let everything settle in, let that collagen generate, and then leave you with a more kind of durable long-term result.
And two, did you want to talk about, like, we're at 3 months and really you see the maximum benefit?
Yes. So although we can already see a difference in the improvement in the position of her mid-face as well as the skin quality and the volumization, that's going to continue on for another 3 months. So we expect her final result, like as far as she's going to get with this collagen regeneration, to be around 6 months. So this is really just the beginning of how improved she's going to be over time. That collagen generation, anytime we add something to the skin, kind of the inflammatory response, the wound healing response of the body takes about 6 months to get you to the full effect. Yeah. If there aren't any other questions, I think we'll stop there. And certainly if you do have specific questions, definitely welcome to call us. I'm happy to talk by phone. Our whole staff here is very familiar with the procedure, and they're happy to answer any questions that you may have. But I think we're all set. So thank you for joining us on this webinar, and stay healthy. Keep your skin healthy, stay strong, be well, and we'll see you next time.